are the treatments, the biologics you talked about, or the other treatments for any of the arthritides?
Well, again, for osteoarthritis, you'd start with the basics of, let's say meloxicam or Celebrex. If you want to take a pill, you could also use a short dose of steroids, although we don't like to go steroids because they have their own set of side effects. And the same is true for rheumatoid arthritis. Steroids used to be one of the first lines with aspirin. And aspirin's still a great drug for even rheumatoid arthritis, but you really don't want to do the steroids as much as you can avoid them. And that's where I leave it in the hands of the rheumatologist. Methotrexate, and Humira and all these different biologics. And it's always changing. And how people respond to each of those. In other words, someone may do very well with Humira, but another not. And they keep changing them to find the one that works for you. And so that's where you have to work very closely with a rheumatologist on caring for the rheumatoid arthritic. The osteoarthritic, again, that's just basic mechanical support. And when you can't stand it, then we start discussing surgical options. But I always warn people, the surgical outcome in osteoarthritis is the same now or 5 years from now. You haven't lost time. Rheumatoid, there can be a little bit of lost time. And why? Because the more dislocated and tighter over they are, the harder it is to put arthroplasties in here. So that's the juggle between the non-operative care and then making the decision when to shift to operations.